My name is Samantha Noble, and I completed my senior preceptorship at the Family Birth Center at Multicare Good Samaritan Hospital in Puyallup, Washington.
And my name is Krista Vavrik, and I was at the Women Newborn Center at Tacoma General in Tacoma, Washington. And we are two senior nursing students at Pacific Lutheran University in Tacoma, Washington. And we're presenting our capstone poster, which is titled Family Birth Center Nursing Care for the Woman Experiencing Postpartum Hemorrhage. We were interested in this topic in population because we're both passionate about the whole nursing process of birth, and we noticed that postpartum hemorrhage was a connection between both labor and delivery and postpartum, and whether it happens in the first couple hours after birth or up to 24 hours in a postpartum unit. We recognize the collaboration between labor and delivery nurses and postpartum nurses caring for the same patient that may experience postpartum hemorrhage, and how it's important to have that collaboration and communication of the risks between those two nurses and the two different specialties. And we only had glimpses of postpartum hemorrhage during our senior preceptorship experiences, and we learned from those experiences. However, we wanted to learn more and research more about the nursing response to that critical condition, and to be fully prepared and fully competent labor and delivery and postpartum nurses.
One thing that really surprised us as we did our research was how common postpartum hemorrhage is. It is considered the most common cause of maternal mortality, and it accounts for 25% of maternal deaths worldwide. It is also considered the most commonly occurring OB life-threatening emergency, as one woman dies as a result of a postpartum hemorrhage every 4 minutes worldwide. We truly did not know the significance of postpartum hemorrhage and how deadly it can be if left untreated. And going off that, another huge surprise for us was how big of a medical emergency this is, and how nurses are the ones who spend the most time with their patients, and thus are the ones who will call other providers in when this emergency occurs. This means that they're the first ones to notice differences in their patients' conditions and their baselines, and then implement immediate interventions before anyone even comes to the emergency. In addition, research showed that early and quick recognition of postpartum hemorrhage is associated with increased survival rates. So nurses must be aware of these changes in their patients' conditions and investigate these changes so they can ensure survival. One thing that was reinforced in our research was the importance of the nursing process. Throughout the last 3 years of nursing school, we have learned about the nursing process and how important it is in our care. In addition, through this research, we found that the assessments of postpartum and labor and delivery nurses will be the ones that drive the interventions that are employed in postpartum hemorrhage cases. In addition, we found that the evaluation of one's nursing care is critically important in postpartum hemorrhage cases, as research is found every day about the best care and evidence-based recommendations for nurses. So nurses must look into this research and identify the best care for their patients. Something that we have seen in practice that was reinforced in our research was fundal massages. A study found that 25% of mothers who did not receive any postpartum fundal massages needed more pharmacological interventions to contract their uterus later on, which means that nurses can prevent these pharmacological interventions and prevent postpartum hemorrhage from evolving if they do fundal massages postpartum. And the multi-care hospitals that we were at both stress the importance of fundal massages in postpartum labor patients, and we found that this policy is aligned with current research. Overall, one important thing we want our viewers to take away from our poster is that early recognition of postpartum hemorrhage increases survival rates of mothers. So nurses must know their assessments, must know the risk factors and early warning signs of postpartum hemorrhage, and the interventions needed to support hemodynamic stability in order to make sure that their patients survive. In addition, the 4 main causes of postpartum hemorrhage are known as the 4 T's, which are tone, tissue, trauma, and thrombin. And the 4 T's has a lot of research backed on it about how important these are for nurses to know in order to drive their assessments as well as the interventions. In addition, the treatment of postpartum hemorrhage is directly related to the cause. So nurses must be able to identify the cause quickly and effectively, and then use the 4Ts to drive their interventions. In addition, postpartum bleeding can quickly progress from hemorrhage to hypovolemic shock if proper blood measurement and assessment of the mother's vital signs and hemodynamic status are not employed. Nurses must know how to treat every level of severity of postpartum hemorrhage, from excessive bleeding to just assessing all of their patients' risk factors for postpartum hemorrhage to administering blood products in the case of hypovolemic shock.
Finally, we just wanted to acknowledge and thank our preceptors at the Family Birth Center at Good Sam, Jessica Ruby and Elena Kane at Tacoma General for their support and providing us with the tools and knowledge to be more competent labor and delivery and postpartum nurses. And we'd also like to thank our professors and our clinical instructors at Pacific Lutheran for supporting us throughout the last 4 years. Thank you so much for your interest and your time in watching our video.